Hello, my name is Rebecca Hernandez. I'm a certified prosthetist orthotist at Children's Healthcare of Atlanta. Today, on behalf of our team, I'd like to present our center's early knee protocol in children with bilateral, high-level, or above-knee amputations. There has been much debate and discussion as to whether or not a prosthesis should have a functioning articulated knee until the child is between 3 and 5 years of age. Much of this discussion has been centered around the child with a unilateral deficiency. The reason for concern that has been raised in the past is that there is the assumption that the knee would buckle, creating an unsafe situation for the new walker, or that knees were not small enough, or that the prosthetic knee center would be lower than the sound side knee center. Recent research has indicated that an advantage to adding an articulating knee to the first prosthesis is that during developmental stages, toddlers flexed their prosthetic knees and used the flexion to aid in and out of sitting in upright positions even prior to walking. There are newer knees that are size appropriate, and having a lower knee center on the prosthetic side has not been found to be detrimental. Dr. Geil and Dr. Coulter found that infants will flex their prosthetic knee during crawling, will crawl faster, and will demonstrate less compensatory movements with a functional articulating knee. And just like older children, young children will learn to control a flexing and extending knee joint by using hip musculature and shifting their weight line. At last year's ACPOC meeting, Dr. Geil presented the results of his research on walking kinematics in young children with a conventional or locked knee compared to an early knee protocol in which a single axis or polycentric knee with extension assist and stance control features were removed. The study looked at 3 subjects with a locked knee, 3 with an early knee, and 3 age-matched controls. It was concluded that if a knee is provided, children will flex it during swing, and although clearance compensations were still present in some, they were 2 times less prevalent in those with an articulating knee. Additionally, those with the articulating knee gained walking speeds comparable to their able-bodied peers, however, those without a knee did not. These discussions are centered around those with unilateral involvement. However, the need for mobility for transitions are even more evident in those with bilateral involvement. Because knee center discrepancies and clearance for components are non-issues, and stability can be achieved through alignment, at Children's Healthcare of Atlanta, we have been fitting those with bilateral above-knee amputations with the same early knee protocol as our patients with a unilateral above-knee amputation. I'll now introduce you to 2 patients currently in treatment, both under the age of 4, who were started out with articulating knees, as well as 2 young men who are now in college but were also fit with articulating knees in their first set of prostheses. Here's Milo. He is an adorable 2-year-old male who had bilateral knee disarticulations at 11 months of age for tibial deficiencies. Milo was fit with his first prostheses at 6 weeks post-op. His prostheses consisted of laminated sockets with sock interfaces, a test belt suspension, and an Autobach 3R38 single-axis knee with the extension assist removed. The feet I used were TRS Little Feet, which provided flexibility in crawling and pulling to stand. Our goals for Milo initially were to have him develop a strong foundation in crawling, tall kneeling, pulling to stand, and then eventually walking. As you can see in this video, he is demonstrating the use of the knees during his transitions from prone to tall kneeling and eventually to standing. He received PT at our center and also at home with a community provider who partnered closely with Colleen Coulter, his PT at Children's. He began using a walker about a month to 6 weeks after receiving his first prostheses. Milo is now 2 years and 3 months of age and has been walking independently for 2 months. He received his second set of prostheses with acrylic socket, sock interface, and test belt but this time with Autobach polycentric 3R66 knees. Again with the knee extension assist removed and the stance stability reduced. According to the manufacturer, the knee is suitable for ages 3 to 6, but we regularly use it for younger patients. Milo's parents report that he began walking independently 1 year following the initiation of walking with a walker, and this has allowed Milo to now begin preschool, and he's also working on potty training. So here he is. This is a video that his parents caught when he was just beginning to walk independently. Next, I'd like to introduce you to Jackson. He is a 3-year, 10-month-old boy who is born with multiple pterygium syndrome, with knee flexion angles at 90 degrees and right equinus positioning. He has been treated with growth hormones. At 10 months of age, his parents opted to have him undergo a right femoral shortening, release of hamstrings and Achilles tendon, and a right knee capsulotomy. But they knew that bilateral knee disarticulations may be inevitable. At 18 months, due to the persistent knee flexion contractures, his parents did opt for bilateral amputations. At 6 weeks post-op, Jackson was fit with his first set of prostheses, similar in design to Milo's, with acrylic sockets, test belt suspension, 3R38 knees, and TRS feet. Again, the extension assist was removed, and Jackson began walking with a walker in his home and standing independently for greater than 30 seconds, just 3 weeks after the delivery of his prostheses. He was receiving PT weekly, and he certainly progressed very quickly. At 3 months post-fitting, Jackson was walking holding on to just one hand. He began walking without assistive devices 7 months after receiving his prostheses, and received his second set of prostheses that consisted of the same socket design and suspension, but again had Autobach 3R66 knees and College Park Trooper feet when he was 2 years and 8 months of age, 13 months after his initial set of prostheses. He had become fully independent in walking and traversed all obstacles and terrain. Since Jackson was fully independent and his parents were requesting devices for playtime activities, he was provided with slippers or foreshortened prostheses. His mother reports that he currently prefers regular prostheses, but he does use his slippers for some things like riding his trike. Typically, we offer these foreshortened prostheses once they have mastered walking independently with their articulated knees. Jackson is now 3 years and 10 months of age and is very active. He and his family recently went to Yellowstone and Grand Teton National Parks, and he refused to sit in a stroller or be carried. His family has horses, and he goes to the family's barn every day to care for his horses, and while he's there, he walks at least a mile a day. He certainly, as you can see from these videos, he goes up and down hills with no problems. Next, I'd like to introduce you to Cameron. He is a 20-year-old male who was first seen in our clinic at 11 months of age when he underwent bilateral knee disarticulations due to tibial deficiencies as well. He was fit with articulating knees in his first set of prostheses and like the other two, has done remarkably well. He has worn his articulating prostheses consistently, but he has had some slippers for home use in certain activities, as well as a wheelchair for backup. He has been very active all along and routinely breaks components doing flips or horsing around with his friends. Cameron is now away at the University of Georgia, and his prostheses consist of suction sockets, Oser Rio XC microprocessor-controlled knees with dynamic feet. Here's a video of him walking. He uses these prostheses daily to get around campus. Jockey is another 19-year-old male who was also born with tibial deficiencies and had his knee disarticulations at 9 months of age. He also wears suction sockets with Rio microprocessor-controlled knees and uses them daily around his campus at Jackson State University. When he was younger, he used slippers for playing football, coaching Pee-wee football, and marching band. He still uses his slippers for marching band at university, and he uses his articulating prostheses for his work, which is unloading and loading trucks, and for working out, as well as everyday walking. In conclusion, it's the experience of this center that if the child is given the opportunity, has good support from their family and healthcare team, they will quickly learn to use their prostheses with articulating knees safely and effectively. Thank you very much.